Understanding Genetic Risk of Pancreatic Cancer. Hello, this evidence-based content is prepared by Saboor Khan, fellowship-trained consultant surgeon. And if you or someone you care about has recently been diagnosed with pancreatic cancer, and you're wondering whether this could affect your family members, you're in the right place. I know hearing pancreatic cancer is overwhelming enough, but then learning there might be a genetic component can feel like a whole new layer of worry. But here's what you need to understand. Genetic testing isn't just about identifying risk for your relatives. It could actually change treatment options for the person with cancer right now, potentially opening doors to therapies that work specifically for inherited forms of this disease. By the end of this video, you'll understand why all pancreatic cancer patients should undergo germline genetic testing, which genes matter most, what positive results mean for treatment with targeted therapies like PARP inhibitors, and crucially, what this means for your family members' cancer risk and screening options. Before we dive into the specifics, let's quickly establish what we're dealing with. Germline genetic testing looks at the DNA you inherited from your parents' mutations that are present in every cell of your body from birth. This is different from somatic mutations which develop only in the tumor during your lifetime. Now, why does this matter? Because approximately 10 to 15% of pancreatic cancers are attributable to genetic causes. That means roughly 1 in every 7 to 10 people diagnosed with pancreatic cancer carries an inherited mutation that contributed to their disease. And here's the crucial part. About half of patients carrying these mutations have absolutely no family history of pancreatic or related cancers. You can't rely on family history alone to identify who should be tested. This is why the American Society of Clinical Oncology and National Comprehensive Cancer Network now recommend universal germline testing for all patients diagnosed with pancreatic adenocarcinoma, regardless of age, family history, or any other factor. Let's start with the most important genes, BRCA1, BRCA2, and PALB2. You've probably heard of BRCA genes in relation to breast and ovarian cancer, but they're critically important in pancreatic cancer too. These genes are involved in something called homologous recombination repair. That's the cellular machinery that fixes double-strand breaks in your DNA. Think of them as your cell's emergency repair crew. When these genes have pathogenic variants, harmful mutations, cells can't properly repair DNA damage. But here's where it gets interesting. These mutations make cancer cells exquisitely sensitive to certain treatments. Because tumor cells already have defective DNA repair from the germline mutation, adding platinum-based chemotherapy which damages DNA creates what scientists call synthetic lethality. In patients with metastatic pancreatic cancer and BRCA1/2 or PALB2 mutations, platinum-based chemotherapy produces response rates ranging from 50 to 80%, with median overall survival reaching up to 22 months. Compare that to patients without these mutations, receiving the same treatment response rates around 32% and median survival of 11 months. That's potentially doubling survival time. And there's more. After initial platinum chemotherapy maintenance therapy with PARP inhibitors, drugs like olaparib or rucaparib can extend the time before disease progression. These PARP inhibitors work by blocking another DNA repair pathway, creating a double hit that cancer cells with BRCA or PALB2 mutations simply cannot overcome. If you're supporting someone through pancreatic cancer and they haven't had genetic testing yet, this is a conversation to have with their oncologist immediately. Testing should happen soon after diagnoses to guide treatment decisions. The ATM gene encodes a protein that plays an important role in how cells respond to DNA damage. Germline pathogenic variants in ATM have been reported in approximately 3% of families with familial pancreatic cancer. Now, what about ATM's impact on treatment? While it's not a core homologous repair deficiency gene like BRCA, patients with ATM mutations may still benefit from platinum-based chemotherapy. The evidence is evolving, and current practice typically involves treating these patients with platinum regimens, though they wouldn't qualify for PARP inhibitor maintenance therapy under current guidelines. For family members carrying an ATM mutation increases pancreatic cancer risk, although the exact magnitude depends on family history. If you have an ATM mutation with one or more affected first-degree relatives, parents, siblings, or children, screening is recommended. Lynch syndrome caused by mutations in DNA mismatch repair genes is typically associated with colon and endometrial cancer, but it also increases pancreatic cancer risk. While less common than BRCA mutations in pancreatic cancer, identifying Lynch syndrome has important implications. Here's something that might surprise you. Pancreatic cancers arising in Lynch syndrome sometimes show microsatellite instability, a specific pattern of DNA errors. When tumors have this feature, they may respond to immunotherapy drugs like pembrolizumab, opening yet another treatment avenue. The CDKN2A gene, also known as P16, causes familial atypical multiple mole and melanoma syndrome. People with CDKN2A mutations who develop multiple atypical moles and melanoma are at markedly increased risk for pancreatic cancer. In a 20-year prospective study, pancreatic cancer surveillance in CDKN PALB2 carriers detected early neoplasms at a potentially curable stage. Other hereditary conditions include Peutz-Jeghers syndrome caused by STK11 mutations and hereditary pancreatitis from PRCS1 mutations, which carries an estimated 25 to 44% lifetime risk of pancreatic cancer. That's extraordinarily high for context. Remember that pancreatic cancer affects about 13 in 100,000 people per year in the general population. Now you might be wondering, if my loved one tests positive for one of these mutations, what does this mean for me or other family members? This is where Cascade testing comes in. That's when family members of someone with an identified mutation get tested for that specific genetic change. Because these are germline mutations, if your relative carries a BRCA2 mutation, for example, you have a 50% chance of inheriting it if they're a first-degree relative. Here's what matters most. Identification of at-risk family members allows for enhanced cancer screening and, in some cases, preventative measures. For BRCA mutations, this includes screening for breast, ovarian, prostate, and pancreatic cancer. For pancreatic cancer specifically, high-risk individuals should be referred to specialized screening programs. Screening typically involves endoscopic ultrasound or MRI-based imaging methods, which can detect asymptomatic early pancreatic neoplasms at potentially curable stages. In one study, the cumulative 10-year incidence of pancreatic cancer or high-grade precursor lesions was 22% in germline mutation carriers versus 7% in those without mutations, a threefold difference. If you're worried about someone you love who might have inherited a mutation, understand this surveillance programs exist precisely because early detection saves lives. A multi-center study showed that pancreatic cancers detected through screening in high-risk individuals were caught at earlier stages with significantly better survival outcomes. For patients recently diagnosed with pancreatic cancer, request germline genetic testing from your oncologist immediately if it hasn't been offered. Testing should include at minimum BRCA1, BRCA2, PALB2 ATM, and Lynch syndrome genes. Most cancer centers now use multi-gene panel testing that covers all relevant genes at once. Ask specifically whether results will be available before finalizing your treatment plan, as positive results for BRCA or PALB2 mutations should influence first-line therapy choice toward platinum-based regimens. If you already have metastatic disease and carry a BRCA or PALB2 mutation, discuss whether PARP inhibitor maintenance therapy is appropriate after initial chemotherapy. For family members, if your relative has tested positive for a pathogenic variant, schedule genetic counseling to discuss whether you should undergo testing for that specific mutation. Most insurance covers this when there's a known family mutation. Document your family cancer history thoroughly, not just pancreatic cancer, but breast, ovarian, prostate, colon, and melanoma, as these cluster in hereditary syndromes. For patients with pancreatic cancer, given that I have pancreatic cancer, what germline genetic testing do you recommend and when will results be available? If I test positive for BRCA, PALB2, or another mutation, how will this change my treatment options? Should my family members be informed about potential inherited risk? For family members of affected individuals, my relative was diagnosed with pancreatic cancer and carries a specific gene mutation. What is my risk and should I be tested? If I test positive, what screening is recommended and at what age should it start? Are there other cancers I should be screened for based on this mutation? For BRCA2 mutation carriers with at least one affected first-degree relative, or BRCA1 PALB2 ATM carriers with one or more affected first-degree relatives, screening typically begins at age 50 to 55 or 10 years younger than the youngest pancreatic cancer diagnosis in the family. Let me quickly recap. Genetic testing in pancreatic cancer serves two critical purposes: guiding precision treatment with platinum chemotherapy and PARP inhibitors for those with BRCA or PALB2 mutations, and identifying family members who may benefit from screening. Your next step, if you or a loved one has pancreatic cancer, request germline genetic testing immediately. This information is for education. Always discuss your individual situation with your healthcare provider. I've outlined several reputable resources here, which you may find valuable for further information on this topic. All links are available in the description below. Thank you for watching.